Can Tadalafil and sildenafil used for erectile dysfunction cause blindness? Have you heard about this connection? Watch this video to learn about vision-related side effects of these medications. Let's dive into today's topic. Some patients report visual changes when using Tadalafil and sildenafil for erectile dysfunction. Common effects: tearing, blurred vision, reduced acuity, narrowed field, and rarely color changes. Literature describes extreme cases of blindness from medication abuse. But does this actually make sense? Can Tadalafil really make you go blind? As we know, 5-phosphodiesterase inhibitors like Tadalafil and sildenafil are the primary medications for treating erectile dysfunction. Tadalafil is also used to treat benign prostatic hyperplasia or enlarged prostate. Both act as vasodilators, increasing blood flow to the penis and improving erection quality. However, this vasodilation effect isn't limited to the penis, it's systemic. It occurs, for instance, in skeletal muscles, sometimes causing side effects like muscle pain, myalgia, or facial flushing and congestion due to facial vasodilation, and even headaches, which are quite common due to vasodilation of blood vessels in the head. Additionally, vasodilation can occur in the eyes. The dilation of eye arteries can lead to fluid buildup, causing tearing and affecting vision. Severe cases in literature link to retinal detachment and even blindness. A recent study in the American Journal of Sexual Medicine from October 2023 addressed these issues. It examined 3 serious eye effects linked to PDE5 inhibitors, specifically sildenafil and Tadalafil. Patients were monitored for retinal detachment, ischemic optic neuritis, and retinal vascular occlusion. Millions of patients were studied from 2007 to 2021 using an American database. Regarding patients with erectile dysfunction, 1.9 million were surveyed, and about 31%, or 615,000 patients, used sildenafil and Tadalafil for treatment. These patients were monitored over this period, while 2.1 million patients diagnosed with BPH were followed, and those using Tadalafil, approximately 8% or 190,000 patients, were monitored for the occurrence of adverse ocular effects. In other words, the study was comprehensive and included a very large population. As a result, for patients with erectile dysfunction who used Tadalafil and sildenafil, no strong risk factor was associated. No significant evidence of these 3 outcomes was found, such as retinal detachment, optic neuropathy, or retinal vascular occlusion. For patients using Tadalafil to treat BPH, benign prostatic hyperplasia, an increased risk for retinal vascular occlusion was observed. However, when evaluating the entire population with prostatic hyperplasia, it was noted that those using other types of medication, such as transfluoxetine, finasteride, dutasteride, or even those who had surgery, this group also had a higher risk for retinal vascular occlusion. In other words, there was no specific causal factor linked to Tadalafil use. So folks, what can we conclude from this recently published study? There's no strong evidence linking blindness or serious eye events to Tadalafil or sildenafil use for erectile dysfunction or benign prostatic hyperplasia. However, this does serve as a warning. Patients with pre-existing eye conditions need an eye exam before starting this type of medication. Those who develop eye issues during treatment should stop and see a specialist. If you found this video's content interesting and important and think it could benefit someone you know, please share this information. Don't forget to like this video, subscribe, and turn on notifications to stay updated on weekly content. Take care.